Hello, everybody. This is Judy Sleed with The Play is the Thing, and I have a wonderful playmate today, Dr. Rosner. How are you?
I'm very good.
Well, I'm so glad you could come and tell us all about dentistry that you're an expert on, right?
I've been in it for 30 years.
Wow, that's a long time. Yes. You're hardly old enough to do that for 30 years.
I did start very young.
Yeah? And was that your life ambition to be a dentist?
No, it was one of those that probably in college I was deciding what I wanted to do, and I always wanted to do medicine, in the medical field. And just growing up, I always was very mechanical. I enjoyed art. And when it came to a decision on what I wanted to go into, a friend of mine sort of suggested, well, why don't you try dentistry? And I said, no way.
No way.
I had the fears like everybody else, with growing up and having teeth drilled on. And I was saying, no. I said, nobody would want to come to me, whatever. And he says, no, you'd be perfect. He says, you enjoy working with your hands, you enjoy your artwork, and you have a biological medical background. And then I started pursuing it, and I realized I did.
Right out of college?
Out of college, yes. I made the decision, and I've enjoyed it.
And you never regret it?
I've never regretted. I felt like as the years have gone by, I've grown with it. Dentistry has changed from what it was originally like, a lot of things that we do. So it's, at this point now, a lot of my art, that I've always enjoyed has come out. We can do our own designs. So I've been enjoying it more and more as the years go by.
Yeah, I could tell that you're enjoying it when you're working on my teeth. So you said that there is a lot of new things in dentistry.
Yeah, when I went to dentistry, the first thing when I was going was pain management. And they were trying to come out ways to make it so people had less fear. And it was first training young children to come to dentists, at an early age, and making the environment a nice, pleasant environment for them. And then some of the other things that we've come out with we have different kinds of anesthetics that we can give in different ways, so it's not like with children, they're not seeing a needle. We have this.
You have many children customers?
We have, in my practice, we have children from very young children, very young with their first set of teeth, to the elderly. So I treat all.
Oh, you do?
So that's why I've been treating families, and now their kids and everything. So it's a very family-run practice.
Well, I have to say that your office is very pleasant. When the waiting room is lovely. You even have a working fireplace and a lot of beautiful artwork around. It's very, very pleasant.
Well, that's the other thing, was the environment. I thought that was important. A lot of people come into an office, it's very sterile, and they're nervous already. And I wanted it to be like, when they come into my office, to feel like they're home and they're part of our family. So they have the nice warm fireplace in the wintertime. We have all the artwork, and some are from local artists that have done it and contributed over the years. The house is a 1870 farmhouse. It's a historic farmhouse on the Halsey farm. Yes. And we restored it and tried to keep everything pretty much the way it was. And
there's a lot of a room for parking.
Oh, there's a lot of room for parking. Yes, it's on about a 2 acre of property.
Yes.
There. And we're surrounded by a nature preserve and some farmlands. So, and the windows you can see out the windows, you can see the farm field. So it's a more relaxing type of atmosphere.
Right.
There.
So you want to tell us something about this picture here?
Yeah, this is some tooth replacement options. Some of them are what we've been doing for years. Somebody loses a tooth, and we can replace it with a simple, this is what we call the Maryland bridge, if somebody loses a front tooth. that was some of the early options. The other early options was removable type of teeth, like removable dentures. Then we have where you can make something more permanent, like a permanent bridge. And like if you're missing a front tooth, we would crown each teeth on each side and have something permanent. Now we've come out, and probably the past 20 years is the implants have really been perfected. And they've become almost the ideal treatment for replacing teeth. But you still have to be a candidate for it. There's still some restrictions for implants. Implants are not for everyone. We can do implants for a lot more people that we couldn't before. Some people that were missing teeth for many years and they've lost bone, we can replace the bone, we can enhance the bone.
Really?
Some areas where they've lost back teeth, where they've lost bone because the teeth were out for like 20 years and your sinuses are in the way now and there's not enough bone, so they can do what's called sinus lifts and create bone. So the implants have become more stable than what they used to be. Years ago, when they first came out, they put this whole mesh in your mouth of implants, and most of those got rejected. When I was in training at Columbia in the city, we did these full mesh implants under the gum, and I'd say probably 95% of them were rejected. Then when they came out with the single implants, which are these, they became the more what we do now is the single implants, where you have somebody who's missing a tooth, and you have to make sure we have now advanced x-rays. We do 3-dimensional x-rays, and you can see everything in 3 dimensions, the bone density, the width, the height, and from there you have a treatment plan, whether we have to add more bone or create it, and you can design how the implant goes in. When I was starting with implants, we just would look on an x-ray and kind of figure out, well, I think we can put it in this space. And then when you go to restore it, you realize you put it too far over one way, it went too back, so it wasn't an ideal situation. But now we have surgical guides where we do a 3D imaging, and then you can design it on the 3D imaging and design exactly where you want the implants, the size, and placement, and then you put the surgical guide in the mouth while you're doing the surgery, and you just put the implants in where they are, and then the final outcome is so much better that you can have cases where, this is like a case where someone has no teeth and they had the implants put in, and then you can restore it with the teeth there. So, and there are different kinds of implants that you can do. You can do individual implants. This is a full bridge implant. So it depends on the case there.
Well, how long does it take for a full bridge, like
a full implant?
Yeah,
that's what I'm saying. It depends on the individual. If they have enough bone, sometimes they can put the implant in right away. Sometimes they'll take the tooth out and put the implant in, and then it's got to sit in the bone from 3 to 6 months, and it's underneath the gum. And then once we call it the osseointegration, where it integrates with the bone, then we can restore it, and then you can build the tooth up. And an implant is, like in this one, the implant's like a screw. It's like a hollow screw, and inside this screw here is where we put another screw and build up the tooth on it. So it's like a screw within a screw. And that's how it's built. That's where the mechanics come in. That's the mechanical part of it.
I know you said that you have to be a candidate for it, but
yes.
Does it make any difference how old you are?
No. As long as your bone is good, you can be any age. Usually, I would say we don't do implants on somebody younger than 18 because you want their teeth to be in place. Yeah. So you want all the bone to develop it. But they're doing implants on 80, mid-80s.
Really?
I've seen 90s.
Really?
Yeah. I've had patients come in and tell me, if I knew I was going to be around this long, I would have had my implant. And they're like 95.
Exactly, because when I was in my 60s, I said, why bother?
Right, I'm
I
too
won't
old.
be around. I won't be around long enough.
And nowadays, with people living longer, a lot of people in their 80s and mid-80s are having implants put in. So if you're healthy, you can have the implants if the bone density and everything.
Everybody come to Dr. Rosner. She's in Watermill here in Long Island. And she'll be happy to give you an implant. And besides, in your spare time, when you're not doing teeth, then you are riding horses.
Right. Yes, and competing.
And competing.
Yes, yeah. I started riding now it's about 25 years ago.
You started?
Riding. I started riding as an adult.
Really?
I rode when I was younger, but with my education and schooling, not living in an area that was conducive to riding, living in the city, and I always would try whenever we went away, go to a dude ranch but I never rode formally. And when I was in my 30s, I started to ride formally.
Where are you from?
Queens, New York.
What part of Queens?
Near the airport, Howard Beach.
Is that where you grew up?
That's where I grew up, yes.
And you went to school there?
I went to school there.
And you have any siblings?
We're a family of 5. I have 3 brothers and a sister.
Oh, are they all around?
They're all around.
And anybody's doing dentistry?
No, I was the only dentistry, but we are a medical family. My father was a chiropractor, my mother was a nurse. My oldest brother is a ear, nose, and throat doctor.
Oh.
My sister was the one that went into fashion. She worked with Armani for over 25 years.
Wow.
Yeah, so she lives in France.
And she lives in France?
Lives in France, in Paris.
Oh.
Yes. That's where I've learned to do my makeup. I'm not very good on that. But she lives in France and worked with Armani. She started with Estee Lauder, Lancome, Armani, and was there for many years. And then I have a brother that's a veterinarian.
Oh.
And then I have a younger brother who's started as a chiropractor, now he's a lawyer.
Wow, all professional,
right.
The whole family.
Yes.
That's amazing. So, what made you want to ride?
It was when my daughter was born. She was about 4 years old, and she wanted to ride horses, and we had moved out here. And she told me a friend of hers rides horses, and I looked at her and I said, 4 years old, you can ride horses? Yeah. And so I took her to this one of the riding places here. It was a farm, and they would take her on a lead line and ride. And a friend of mine, one of the mothers said to me, she says, well, while our daughters are riding, would you like to ride too?
Oh.
I said, I've always wanted to ride. I always, growing up, any chance I got on a horse, I would ride even though I didn't know what I was doing. And so we started taking riding lessons. And from then on, it was my daughter kept riding, I kept riding. We progressed to horse showing together. We did a lot of the local horse shows, the Hampton Classic, and
I know very little about riding, but there's 2 different ways of riding. Mm-hmm. Isn't it? One is called the...
well, there's the hunter. I did the hunter riding, that's jumping. That's jumping over jumps.
No, I mean the way you sit on a horse.
The equitation.
What?
The equitation, or we sit on a horse. There's a hunter where you jump the horse.
Yeah.
And that's where you have you talk about English and Western style.
Yes.
The funny thing is, when I came out here, I only knew what a Western saddle was. Because whenever these places I went to, they put you on a Western saddle with a big horn to hold. So when I came out here and they put me on a horse, they put me on an English saddle. And it's completely different. It doesn't have that big horn on it, and it's a smaller saddle. So I went around, and they said to me, do you know how to post? And with the English saddle, it's easy to post. You go up and down.
Yeah.
I started doing it on the English saddle. I went up, down, and boom, on the ground because I had nothing to hold on to. but now I've learned over the years to ride.
So you know both.
Yeah. And then we rode hunter, which was jumping, and then I did jumpers, which is where I was jumping, like 2.6 to 3 feet. I did jump up to 4 feet. And then I realized it's time to stay a little closer to the ground. And then recently I've just started doing dressage. I've been riding dressage for the past about 5 years.
What is that?
Dressage is where the horse does these movements. I'm gonna say like the dancing horse.
Oh.
You know, and they go to music and everything. But it's, they used to train the horses in military for dressage movements because it would strengthen their back, and they're become very strong horses. So you'd see those horses with these round necks and the very strong, powerful horses doing movements. And so now I'm doing dressage and showing.
So you started out with your daughter, and is your daughter still doing it?
My daughter, she still rides, but now she's a PhD biomedical engineer in California.
So she's not doing it anymore.
No, I actually have her horse right now because she's out in California and she misses it. She rode all the way to graduate school. She competed.
She's in California?
She lives in California now.
Oh,
yes.
Why did she
She went to graduate school for her PhD there.
Oh.
And wound up meeting her husband, who was a PhD medical surgical resident, and they got married and have a house there.
Oh,
So
wow. All over the place. So you travel a lot.
Yeah, I travel to see her. I have my son here. He's in emergency medicine at Stony Brook University, and he's in his residency. So he's coming back, staying more local, because he likes the local community here. That's where he grew up.
So you say that you entered many competitions. Did
Yes.
you win anything?
Oh, I won. When I was doing hunters, we won. I was reserve champion for Long Island with my hunter when I was doing hunter jumping. That was about in 2003, I think. Now I just started again showing, and we just did regionals up in Saugerties, New York, with my horse, first level.
Really?
But we took
In
first place,
Saugerties?
adult amateur, so I was happy.
My daughter lives in Woodstock.
Oh, Woodstock was very close up there. That's,
Yeah.
So. And now we're working on the next level dressage. You know, that's.
And do you have any fancy outfits?
Oh, we wear white riding pants and white gloves and the black jacket there. I say it's ironic that we wear white, riding pants on a horse. You have to try to keep it as clean as possible, especially when you're showing.
Well, if you have a few outfits, then you don't have to worry about it. You could
Yes.
just keep changing.
You can change. I'm new to it, so I don't have as many outfits right now.
No?
I did hunter for many years, so I have more of that, but I'm switching over to my dressage there.
And I haven't seen any pictures of you with the horse.
Oh, with the horse? Yeah, I don't, I guess I don't have a lot of pictures of myself riding. I used to have all of my daughter, her medals and everything. It was always, I guess I was more proud of her riding, and I always took the side, but now I'm, have more time for myself.
And when you do these competitions, how many others you have to be better than?
Well, when I went up to
people in-
regionals, it was very big classes. When I did the champion, I think there were over 100 horses I was competing against.
And you won.
And I did first, for amateur, because there were professionals and then there's amateurs in there. And I took first overall for the amateurs.
Wow.
Professional, you're
That's
riding
really
against some professional
something.
riders, yeah.
Is there any money involved?
No, it's just what you put out. It's your money.
It's your money.
It's your money that you put out.
And
when I was doing jumpers, if you won, you'd win some money there.
Yeah.
When I was doing jumpers, you didn't win a lot, but
So this is pure
Yeah.
pleasure.
it's pure pleasure. That's my hobby. That's my,
And it's healthy.
and it's healthy. Yes, yes. keeps you. I also did triathlons, which kept me, fit. I did triathlons up until about 4 years ago, and I did. I did Sag Harbor. They have the Mighty Hamptons.
Yeah.
In 2013 and 14, I took first place in my age group.
Wow.
And that's swimming. It's like a mile swim, 26-mile bike ride, and a 10K run.
Oh my gosh! I never knew that about you.
Oh yes.
And now you're telling the whole world.
That's what
How many?
They all laugh at me. They call in the office I'm known as Superwoman.
Oh really?
And
yeah.
they said, "Well, what don't you do?" I said, "I don't
Yeah.
know. I ski. My ski season's coming up, so I'm getting ready for my skiing. I have my plans for that.
Oh.
So I try to fit it all in and work."
Wow.
But that's how I enjoy my work, because it makes everything kind of fun, and sometimes the patients have similar, things that they've done too. So we have some things in common that we can talk about.
Yeah.
I have some patients, when they're a little nervous, and you start talking about. I have this one girl that we started talking about horses, and very quiet, very afraid, and now she comes in. She shows me pictures of her horses, what she does. It's so we have a lot of. It's nice to find common ground.
It is, yes.
And I guess with my kids, I wound up doing a lot of activities, so I always stayed active with them. And now they're staying active with me.
They're staying active with you?
Yes, yes. Yeah.
Yes, well, swimming is great. I love swimming.
But we have a beautiful area here for swimming.
Do you do many different strokes?
Mainly freestyle. I've learned breaststroke and things like that, but when we're swimming for the competition, it's freestyle.
Yeah.
And you're swimming out around here was the bay. You swim out like Sag Harbor, Long Beach, then out in Montauk.
You swim in the bay?
Yeah, in the bay, yeah.
I love the pool.
I like the pool, but you just keep going back and forth. It's like laps, When you have to swim a mile, you're swimming in the pool for about an hour, going back and forth, back and forth.
Yes.
When you're swimming out in the bay, you kind of could look around and see, what's around you, and it's.
Oh, really?
You can see the beaches and the birds. Actually, this morning I went for a run on the beach, and there was a reporting of a sea turtle. And I didn't see it, but sometimes I've seen the sea turtles come up, and it's like the sea turtles come up. Sometimes a deer comes running down. It's just a beautiful way to be out here, and you can run, walk.
I never thought of doing like long-term swimming in a bay. I thought it was just limited.
No, you can swim. We go out. It's a group of us, and we go swimming out, and we swim about half mile, 3/4 mile, a mile,
into the bay?
No, alongside.
Alongside, oh.
You can swim out. Sometimes we'll swim out to a buoy and then swim, but we usually swim parallel to the beach there.
Yeah, it is. That's my favorite.
Yeah. Well, that's
swimming, but I only know breaststroke.
Oh, breaststroke.
I learned to swim in the Balaton.
Oh, okay, yeah.
That's a big lake in Hungary.
Uh-huh. Was it a cold lake, or was the water cold, or?
No.
I don't know. I know some of the lakes can be cold. Yeah.
Huh?
They could be cold, the water, the cold temperature.
No, it wasn't. I don't remember. Yeah. I don't remember it being cold. But that's where I learned to swim a breaststroke.
Uh-huh. I've done breaststroke, but for long distance swimming, I've done freestyle.
I think you go faster with
you
the
go faster, yes, because you can
yes.
breathe and you can go faster on it.
And then you don't strain your neck so much.
Right. Yes. Yeah. Yeah. But with the freestyle, there's different ways breathing. Each side to side. Like when I'm swimming competition, I just breathe in one direction because I'm really putting the power stroke into it when I was doing it.
So with all these things that you know and you've done,
right.
Is there anything new that you're thinking of doing in the near future?
I just when I was having my kids when I was pregnant, the doctor said, "Don't start anything new." He said, "Don't start any new hobbies, new activities, and everything." But I've done, like in the summertime, I've done windsurfing. My son is now into kiteboarding, so he's been letting me dabble a little with the kiteboarding. I'm still kind of, thinking just to stick to the windsurfing. But I've done paddleboarding now. That actually is one of my newer ones.
Really?
Taking the paddleboard and going out and doing the distance, because right on the bay here. And I do, in the wintertime, we have nice, if it's snowy, I'll take my cross-country skis and take them out.
You never thought about doing some crocheting or knitting?
You know, my mother was a big crocheter and knitting and all that. She did needlepoint, and I wished she taught me how to do it. And I said maybe one day I will get back to like needlepointing because it's more, you know, detailed.
That's too mundane for you.
But it's sitting there, and yes, it's. I'd rather draw. Like that. That's something that maybe one day I'd get back into, is drawing.
Well, Dr. Rosner, it's been a pleasure having you here with all your activities. I don't think I know anyone else who does so many things. And we came to an end to this session. And you could watch my shows on YouTube. Don't forget to log into YouTube, and you could see many of my guests. And once again, thank you for being my guest.
Thank you for having me.
Sharing all your secrets with me.